All right, so what we're gonna do in this video here, for the purpose of what we're gonna show from a range of motion standpoint, and then ultimately with exercise, and then coming back in to remeasure range of motion, is how even when we're concerned with an upper body injury, upper body surgery, upper body range of motion, what you do with your lower body in the gym is going to matter. So in your heads, you're watching this video, like we've almost kind of in our heads painted the scenario of, let's say Jeremy just had shoulder surgery. There's obviously going to be limitations to how we could measure things and what we might be able to do from moving him into certain positions, but we'll obviously take the measurements so we can show the impact it's going to have on range of motion. But a really common recommendation when someone has an upper body surgery is you come to physical therapy, you do your upper body exercises for whatever you can do at that stage of surgery, but then they're still going to allow you to go into the gym, do your lower body exercises, do your lower body strength training, because we want to maintain as much of a training effect as possible. That's all still relevant and all still valid in terms of what we're shooting for from a goal standpoint. However, what you do in the gym with your lower body and the lower body strength training exercises you choose is not something that you can just do without any respect to what's going on in the upper body. So the visual that we're going to show in a second is going to illustrate how the exercises you choose to do in the gym for the lower body and how you do those exercises is going to have a direct impact on how the upper body moves. And then in this situation, it's going to impact how quickly you recapture range of motion after surgery, how well things heal, etc. All very, very relevant for an upper body injury or surgery, even though you're doing a lower body exercise. So I'm just going to finish up with a little bit of like manual therapy, help Jeremy to recapture some range of motion, just to get this like moving as well as we possibly can and almost like create the visual with the extremes. This is a technique that we just know for Jeremy from everything we know about him works to recapture his shoulder internal rotation. This is not to say that this exact manual technique will recapture shoulder internal rotation or any other motion on someone else. Again, our assessment process would tell us what is probably going to recapture motion the best. But again, just from our experience with Jeremy, we know that this works for him. So I'll dig in and torture him a couple more times here. And then we're going to use shoulder internal rotation as our pre and post test. So we'll do our best to stabilize and make sure that nothing else is moving besides the shoulder. So would you say about 25, 30 degrees?
Which is actually good for me.
Yeah, again, like we'll laugh because it's true, but even though that's obviously not as much motion as we would want to see eventually, like again, just some things with Jeremy's history, that's pretty good for him. So now what we're gonna do is we're gonna go out into the gym area. And then for the purposes of this, we're gonna stick with the theme of like it being an upper body surgery at a point in the rehab where Jeremy's not able to use his upper body for anything in the gym. So we're literally gonna take the upper body out of the equation and he's just gonna go into walking lunges. So pretty common exercise that you might see someone doing when they have precautions or limitation as far as what they can do after a surgery. Very, very safe for someone to do once they're out of that like initial post-surgical healing phase. We're not worried about infection with sweating or anything like that. And then what you'll see, it's probably not gonna take too much of just a fairly simple, common body weight exercise for Jeremy to potentially lose all the motion that we just gained with that manual therapy. So we'll let him go down and back one more time. Again, form doesn't look completely egregious. It's not like he's intentionally trying to do anything to mess this up. This looks pretty similar to how you might see someone doing this in the gym to begin with. And then once he gets down here, we'll head back into the table and take a remeasurement. So I'm trying to do this live like all the other videos that we're doing this again. So it says like eliminate any possibility of trying to manipulate the measurement, do anything in between. Just take the remeasurement compared to before. And then we see Jeremy's lost pretty much all of his internal rotation. So again, what is the point of this? Upper body, lower body, nothing behaves in isolation. Even if you've had a surgery or an injury in one area, it doesn't mean that you can just blindly go train everything else that doesn't hurt, because it's all going to have an impact on how things move short term. And then ultimately it's going to have an impact on how things progress long term in terms of the trajectory of your recovery. So paying attention to what you do, how you do in all areas of the body from an exercise standpoint is going to be very, very important in all cases.